Hello, everybody. Louise here for the First Lady of Nutrition podcast, and do I have a treat for you? I have a gentleman who's going to be speaking about the new breakthroughs in integrative cancer therapy, and Dr. Dwight McKee is quite a scholar. He has a very, very impressive background as he brings a comprehensive approach to the practice of oncology and hematology, and he's at the forefront, the absolute forefront of the application of integrative medicine in the field of cancer care. This is the kind of doctor you need to know about. Dr. McKee is board certified in medical oncology, hematology, nutrition, and integrative and holistic medicine. So, Dr. McKee, how are you this day, and what is new in integrative cancer therapy?
Well, I'm doing great, Louise, and there's all kinds of new things. I started out doing alternative cancer therapy in the late 1970s.
Oh, I didn't know that.
Yes, I did. I started out I explored virtually all of the alternative cancer therapies of that time, from 76 till 88. And I mostly worked with stage 4 patients who'd been given up on by their conventional oncologists. And one of the most frustrating things for me was that the patients who had an oncologist who were working with me, and I was working with diet and lots of supplements and lots of visualization and lots of confidence building, just convincing them that they could recover and trying to put them in touch with other people who had recovered, because that's the biggest thing is in cancer, really, is the fear.
I know the fear.
Fear keeps people in a sympathetic, nervous system overdrive. And to heal from cancer, you need the opposite. You need the parasympathetic system. That's what runs your immune system. That's what runs your digestion. So people get trapped in fear, and their parasympathetic nervous system can't function, so they can't heal. So I would get them out of fear, and they would be improving, and tumors would be shrinking, and their performance status, it is what is called in clinical oncology, was increasing. And then they'd go back and visit their oncologist, and they'd tell them, how excited they are and what they're doing and how much better they feel. And they say, yeah, well, you'll be dead in 6 months anyway. And, that doesn't matter. The statistics show you'll be dead in 6 months to a year.
Mm.
And then the air would just come out of that balloon, and they would come back to me, say their oncologist said that they were going to die. And it was so frustrating to, kind of start all over with them. And I was able to help. I was able to really significantly help about 20% of stage 4 cancer patients. I even went to Mexico in 1980 and set up an integrative cancer hospital.
Oh my goodness.
And we ended up with Steve McQueen in that hospital.
Oh, I think I remember that, but he didn't die of cancer, did he?
No, he died of a blood clot after we did a large debulking surgery to get all the mesothelioma debulked from his belly, and we were going to make that into a vaccine. His tumors were shrinking, and he was improving, but he just couldn't deal with he had like an 8-month pregnancy of tumor in his belly, and we took all that out. And 12 hours after that, if I had known what I know now, I would have had him on low molecular weight heparin, but that didn't even exist in 1980. So yeah, he died of a blood clot that went to his lungs, and that was it. But that's what we found in that setting, was that we could really help about 20% of stage 4 cancer patients, which doesn't sound like much, but it's 20% more than conventional therapy, especially at the time, was able to do. That's no longer the case because of the new immunotherapies. But there's so much promise of putting together the new immunotherapies with nutrition and lifestyle and supplementation and botanicals. I just can't tell you. To give you an example, when to finish that story, in the late 80s, I decided that, if I was, I really was drawn to working with cancer patients, and I decided if I was going to do that, it might be a good idea for me to become an oncologist. So I went back into training. I had initially gone to medical school, done a year internship, which is what most doctors that went into holistic medicine did at that time, and many still do. And then, started practicing, and I practiced for 12 years. So I went back and had to do a second internship in internal medicine because the one I had done was a little bit of everything. And so I had to do a second internship with people that had just come out of medical school. I'd been in practice 12 years. And then 2 years of internal medicine residency, and then 3 years of hematology oncology fellowship. And then I practiced integrative oncology in San Diego and Montana for 6 years. And then I left practice and I started doing integrative cancer consulting for what ended up being about 60 practitioners, both naturopaths and medical doctors, some herbalists who were taking care of cancer patients on the integrative side. But there was so much they didn't know about oncology. So I was really able to educate them about how their, what their oncologist is likely to say or to them or think, or how they're going to present it and so forth. So I did that for about 15 years. And then that got a little overwhelming because there's so much demand for this. I just, I couldn't deal with it. But I've trained about 40 or 50 people. And one of the people that I've collaborated with in training is Donnie Yance, who is a very gifted herbalist and self-taught. He knows more molecular oncology than almost any oncologist that I know.
Oh, amazing.
And there were some gaps in his knowledge that I was able to fill in. So we made a very good team. And what I wanted to tell you is when the breakthrough in immunotherapy was the discovery of how tumor cells disable the immune response to them. And these antibodies were developed that are called checkpoint inhibitors, which specifically interfere in the way that tumors disable the immune system. And the Nobel Prize for Medicine was for that breakthrough last year. But when these were in clinical trials, Donnie had 4 of his clients in 4 different clinical trials. And there were about 25 or 30 people, all stage 4 cancer patients, in these trials. And in each of those 4 trials, Donnie's client, they were doing huge amount, they were doing a smoothie, they were doing a personalized tincture blend, they were doing lots of supplements, very careful diet, specific detoxification practices. His protocols are really quite demanding, and people who are able to do them do very well. But the point I'm getting to is that in all 4 of those clinical trials, Donnie's clients were the only ones that had a complete response to this new immunotherapy. That was when I said, there's something here. Because, these new immunotherapies are very exciting, but they have response rates in the 10 to 20%, just like I was getting, 40 years ago with intensive nutritional therapy and botanical therapy. So the other thing is that these immune therapies are not metabolized in the liver the way chemotherapies and what are called targeted agents are. And so there's very little possibility for botanical supplements and nutritional supplements to interact, to have drug interactions that interfere, because these antibodies are broken down in the periphery of the body rather than by the liver. Many botanicals, many nutrients do affect the drug metabolizing enzyme systems of the liver. And you've probably heard all the brouhaha about 15 years ago when it was discovered that St. John's wort, a botanical that's often useful in depression, often useful in cancer patients because cancer patients are often depressed, that it enhances the activity of an enzyme that metabolizes about half of chemotherapy drugs. And so it would reduce, St. John's wort would cause a reduced level of the chemotherapy drug. So in general, my practice has been to advise cancer patients not to take any supplements the day before, the day of, or the day after IV chemotherapy to minimize the possibility of drug interactions that are known or unknown. And that's worked very well. When people are taking, oral chemotherapy like Xeloda for long periods of time, I just have them take it as far away from, in fact, I often have them get up in the middle of the night because there's something called chronotherapy. The circadian rhythms interact with the way cancer drugs work. And 5-FU, which is the active drug in Xeloda, is most active at between 3 and 4 in the morning. So I'd have them take it in the morning, in the middle of the night. So it'd be very far away from their supplements. So anyway, I think that the future for integrated medicine around the new immunotherapies is very, very exciting. And there's not only the checkpoint inhibitors, and their toxicities are that of causing autoimmune reactions because they're checkpoints on the immune system. So you take away the checkpoint and the immune system can attack virtually any tissue in the body. And as you probably know, there's an issue with autoimmune disease and what we call leaky gut. And everybody that's treated with chemotherapy has a leaky gut.
Huh.
So again, if we are able to fully integrate these two worlds and start correcting leaky gut, and there's a whole bunch of things that can do that, I think we would see this, the very severe autoimmune reactions to these checkpoint inhibitors decrease. A very mild one is a good sign is associated with efficacy. If people get a mild autoimmune inflammation of their liver or their colon or something like that, it's often a sign that they're going to get a good response against the tumor. But you don't want the big ones where, they just take out the whole pituitary gland. Things like that happen.
So with everything that you're saying, which is really fascinating and very exciting in terms of the future of integrative cancer therapy, my question to you is going to be this, and then we'll repeat this at the end. If some of our interested listeners wanted to get in touch with an integrative cancer therapist that combines the best of all worlds, how would they begin to make the search and know who is appropriate?
Well, as I said, there's about 50 clinicians that have studied with Donnie Yance and I, and actually we're setting up an academy with a physician from Harvard who's very interested in developing a training program for physicians that I'll be part of. So they could contact the Madiri clinic in I'm blocking the name, Ashland, Oregon, and just ask them for practitioners that have studied with them, because all of those practitioners have been exposed to me as well as to Donnie.
Would you spell that name, please? You said it's Madiri.
Yeah, Mederi.
Madiri Clinic in Aspen.
In Ashland, Oregon.
Oh, Ashland. I'm sorry,
yeah,
Ashland,
Southern Oregon. Right.
Excellent. And
that'd be a good resource.
That's I want to make sure that we have that noted in the show notes as well. The other thing is, if you were to choose the top 3 botanicals to fight cancer, what would they be based on the efficacy that you saw with the Donnie Yance people?
Well, let me tell you this, Anne-Louise. It is becoming pretty well accepted that cancer begins when a stem cell in the body becomes malignant. And that becomes a cancer stem cell. And from that cancer stem cell, once it gets past the immune defenses so that a clinically evident cancer appears, all of our treatments, all radiation, chemotherapy, surgery, is all focused on the progeny of that cancer stem cell. There's not a single cancer drug on the market that addresses the cancer stem cell at this point in time. Of the drugs that do affect cancer stem cells, one of the most active is the diabetic drug metformin.
Huh.
And I often used metformin. It was clear that diabetics who were on metformin and were treated for cancer had better outcomes than non-diabetics, which you would not expect because diabetics are not as healthy as non-diabetics. But it was the metformin that they were taking that was improving their outcomes. So I often used metformin in non-diabetics as an addition. But the most active agents against cancer stem cells are natural products. And I just, we just had a paper accepted for publication in a European journal called Clinical Medicinal Chemistry that I think is coming out next month. It's called The Big Five Phytochemicals Targeting Cancer Stem Cells. And those are curcumin, EGCG from green tea, sulforaphane from broccoli sprouts or broccoli seed extracts, resveratrol and its cousin pterostilbene, and genistein, one of the soy isoflavones. The problem, or the challenge, is getting high enough levels of such natural products in the body. They would be ideally delivered intravenously. That would work fantastically well. But to deliver them intravenously would definitely make them drugs. And so if you put all five of those together as an IV drug, you'd spend $1 billion getting it approved. And the natural products don't have what's called composition of matter patents, which is what pharma depends on, to get back their investment, and also make what are pretty outrageous profits with the markups that they're able to get, especially in the cancer field. We've got just runaway costs with these new drugs. I'm talking about the excitement of the new immunotherapies, but they can run $1 million a year. So something's got to happen to get a handle on this. But there's all sorts of other immunotherapies developing, the CAR T cells, bispecific antibodies which bind a cancer cell and a natural killer cell or a T lymphocyte, that have a lot of promise. So this whole field is exploding. When I went back into training, what I was interested in was immunotherapy. And we had, IL-2, interleukin-2, and I learned that low-dose interleukin-2, given subcutaneously, could really help a lot of my cancer patients, and I used that. But it wasn't until the breakthrough with the checkpoint inhibitors that the money started to pour into immunotherapy research, and it continues to pour. And when it's discovered that integrative medicine has so much to offer the emerging field of immunotherapy and cancer, is when we're going to see things really turn around. And we, none too soon, because we've created a perfect storm for cancer. I think we're going to see an epidemic of cancer, unprecedented, because we've contaminated the environment with huge amounts of carcinogenic chemicals. Each one was tested by themselves, but nobody ever thought to test them together. And some small groups have started to do that. And you take 5 or 6 environmental chemicals at levels that people are exposed to in the environment that singly are not carcinogens, and they become carcinogens when you've got 5 or 6 of them. So
Exactly.
This has already happened. We're all exposed to it. Babies are born with carcinogens in their blood that they got from their mother. we've industrialized the food supply, and we've created a very stressful environment, and we've divorced ourselves from the natural solar spectrum, and we've got this huge EMF environment that we have no idea what it's doing. And these factors that I'm just ticking off, I think are going to drive an epidemic of cancer. So I think we're going to have to get way better at treating it, or we're going to see unprecedented levels of suffering, unbelievable medical expenses that can bankrupt countries, and a huge amount of human suffering.
So my other question to you, you mentioned something very interesting that I took notes. I'm taking feverish notes because this is all very insightful and enlightening information. And there'll no doubt be questions for this podcast. But how does one keep themselves in parasympathetic balance if one is driven by the sympathetic nervous
Well,
system?
Daily exercise kind of stimulates the sympathetic system, but then you get a parasympathetic response after that. So and exercise burns up the stress hormones. That's what they're designed to do. We're hardwired for flight or flight. Adrenaline and cortisol, the adrenal glands, have kept our species alive because, when you had to run from the saber-toothed tiger or whatever the physical life threat was, this allowed us to perform at amazing levels physically. But in modern life, somebody cuts you off in traffic and you get a big adrenaline response.
Right.
Somebody, you have a deadline at work and you've got adrenaline and cortisol response. So we have all these. You watch a movie or a TV program that has stuff that triggers adrenaline. People like that, but there's no place for that adrenaline and cortisol to go. It's designed to drive maximal physical effort, maximal physical response. And so when we are in modern life having all these adrenergic stressors stimulating our adrenal system, and we're not doing any exercise, that gets, that's a toxic soup that we're brewing inside of ourselves. And so daily exercise, or nearly daily exercise, helps to burn up all that stuff that's being generated. It may not be at the same time. Ideally, if somebody cuts you off in traffic, you should park the car and, run up and down the side of the hill 20 times and get back in your car. But just daily exercise is really important for managing stress. And then practices like meditation and mindfulness and walking in nature. They talk about forest bathing. I'm walking around on my deck right now looking at pine forests that we're surrounded by. Just being in nature stimulates the parasympathetic response, the relaxation response. I mean, Herbert Benson at Harvard started talking about the relaxation response
years
30
ago.
years ago. Exactly.
Are there
and
any
that's key for preventing cancer and recovering from cancer.
This is so very important, but my question is, so many of my people are foodies. Are there any particular superfoods or nutrients that push you more into parasympathetic? Any minerals that do so?
Well, magnesium and potassium are absolutely essential. In general, an alkalinizing diet, a plant-rich diet, is going to support the parasympathetic system more than than an animal protein-rich diet. In early cancers, there is a very good possibility that a ketogenic diet will be helpful. But the ketogenic diet people, one of the people that I studied with before I went back and became an oncologist was Emmanuel Ravisi in New York City.
Oh, I knew Emmanuel Ravisi.
Yes, I studied with him for 6 years. It took me 3 years to read his book his text that he published in 1961.
I bet.
And there's so many insights that I have from having worked with him, and one of them is that the ketogenic diet is in his system catabolic. It supports catabolic metabolism because the ketones are catabolic, and when cancers begin, they're always anabolic. It's an excess of growth. So a catabolic diet, and this is not exactly sympathetic and parasympathetic. There's a number of kind of yin-yang dualisms that go on in human physiology, and anabolic catabolic is another one. But they fluctuate. A healthy person is, goes into the anabolic swing about 4 a.m. and that maxes around 10, and then they go into the catabolic swing around 4 p.m. and that maxes out in the night, and then they hit anabolic again. But somebody with cancer is fixed either catabolic or anabolic, and they're always anabolic in the beginning stages of cancer. So in early cancer, a ketogenic diet is uniformly useful. But when people have been treated, the treatments push them into the opposite phase, especially radiation. So any cancers that recur after treatment, a ketogenic diet is very likely to be counterproductive. And that's not understood by the people who are
ketogenic advocates.
Working with ketogenic diets in cancer. They just think, ketogenic diet's always good for cancer. It just depends what phase the cancer's in. And it's always going to be helpful in the early phases.
Fascinating. So that leads me to another question. I know the work of Nicholas Gonzalez, may he rest in peace. Nick believed that there was not one diet that worked for every type of cancer. How do you feel about that?
Well, my first mentor was William Donald Kelly. So,
I think I knew that.
Yes.
Oh my gosh.
And that's who Nick Gonzalez's mentor was.
Yes.
Yeah, I kind of passed the torch to Nick. I went from Kelly to Ravisi. Ravisi was my second mentor. So Kelly was a very intuitive. He was a medical intuitive.
I didn't know that, Dwight. I didn't know that. We have to talk about that offline a little bit. I just want to let you know that my mentor, Dr. Parcells, said she was the one that cured William Donald Kelly. Apparently, just so that you know, she was never given the credit, but that's what I was told.
He would certainly not give the credit to anyone else. I knew his personality well. He was a mixture of many things, but he did teach me useful things. And he had a whole sympathetic, parasympathetic paradigm for diet. And by asking people lots and lots of questions, and whether you would flush when you took 50 milligrams of niacin or not would separate you into sympathetic and parasympathetic. So he had this computer program. This was early days of computers when they ran on cards, and people would fill out these extensive questionnaires, and then he divided them into 10 different metabolic types. And Nick simplified that somewhat, made it a little more user-friendly. But I do agree, there's not a one-size-fits-all diet for humans. There are people who are vegans, there are people who are carnivores, and there are people in between who are omnivores. That those are the best diets for them. And it's far beyond our science at this point. Actually, nutrition seems like, the most common thing we eat every day, but biochemically, it's far beyond our science. What happens when food gets into the digestive tract is largely still a black box. And
interesting.
It's so complex. It's so far beyond. I mean, we're going to need artificial intelligence systems to manage the amount of data that would be necessary to really understand this. So we don't have a way of really scientifically saying, this is the diet you should eat. People are trying to do that with the microbiome, and the microbiome is incredibly important, and it's also incredibly important to immunotherapy. I know, as an aside, I know an immuno-oncologist in Israel who specializes in melanoma, which is one of the most immunoresponsive of tumors, and he has done microbiome transplants from melanoma responders into melanoma non-responders to the same therapy, and made them into responders by transplanting the microbiome of the recovered patient. So this tells us that what's going on in our gut, which is also hugely complex, but we do know that there's a species called Akkermansia that's highly associated with response to immunotherapy. People who have no Akkermansia are less likely to respond. And I think that at this point, I think they need to remove the F word. They call them fecal microbiome transplants. And as soon as you say that word fecal, people go, ooh. It's kind of analogous to the early days of MRI. MRI came from a technique in chemistry called nuclear magnetic resonance. And so they developed these machines and they called them nuclear magnetic resonance scanners. And nobody would get in a machine that was called nuclear.
Right.
So they changed the name to magnetic resonance scanning, and that was fine. I think it's the same. We just need to drop the fecal word and call it microbiome transplants. But I think there's a lot of very useful stuff that can be done with these kinds of transplants. But then the diet of the person who has the successful microbiome for whatever therapy also has to be followed, because the transplanted microbiome will not thrive with a completely different diet. But that's where fiber is so important, because that's we call it a prebiotic now. It's the food for the probiotics. It's the food for the microbiome. So low fiber diets are problematic, and there's so many. We've just decimated our collective microbiomes with our love affair with antibiotics, which were arguably the biggest breakthrough in medicine in the 20th century, and dramatically reduced the death rate from infectious diseases. But we've transferred into a whole epidemic of non-infectious diseases,
right,
with chronic degenerative diseases, a lot of which is probably driven by the damage we've done to our collective microbiome.
So if I believe the gut is the second brain. The gut is so reflected in the skin, the hair, the nails, your whole immune system. There's no question about that. But if you were to tell somebody what not to do, or let's put it this way. Let me see. No, I think I want to phrase it this way. What wouldn't you do? What are the don'ts to avoid cancer? Don't do this. Don't do that. Don't wear shoes.
Don't eat refined foods. Don't eat sugar except for celebrations. I prefer the do list to the don't list.
Then what are the do's?
Do eat a diet of whole, unrefined foods, organic if possible, locally grown if possible, grown by yourself if possible. Do stay in connection with nature. If you live in New York City, go spend time in Central Park. It's a little, I'm not sure that New York City would survive if Central Park was removed.
Right.
It's like this little lung for the city. But connecting with nature is fundamental in ways that we don't understand. And being outside and being exposed to the solar spectrum that our ancestors evolved under. We moved indoors 150 years ago with the Industrial Revolution. And now we live with artificial lighting. And I think we need to learn to recreate the solar spectrum indoors.
Yes.
We have the technology to do it. We just haven't.
Yes. That's what we need to do. I'm in touch with a very interesting Russian-trained Israeli doctor, Dr. Tel Oren. Do you know of him at all?
I don't know him, no.
He's phenomenally interesting. As bright as you are, he's almost as bright as you are, which is saying quite a bit. He's kind, he's humble, he's lovely. The two of you would be peas in a pod. He's a gentleman that is a big believer in, I think he calls it sun replacement therapy.
Sun replacement therapy, exactly.
So
yeah, I would like to be in touch with him.
I'm going to get you his contact information shortly. And he also said works with skin cancer. It was an area I also wanted to talk to you about. He has a technique for removing pre-skin cancers and actually skin cancers using a very natural technique with it's a mixture, I think, of tetrachlorohydric, it's a TCA, it's an acid that they use for skin peels.
Trichloroacetic acid, yeah.
He uses a 40% solution of that with some other goodies added to it, and he's gotten a complete healing rate with it, and he uses the correct method of Mohs surgery with that. So he knows,
Right.
he actually studied. Apparently what they've done now is not the real Mohs surgery, it's a bastardized form of it.
Yes, yes. Terrific. That sounds
I've
really
gotta-
terrific.
I've
And
gotta
I wanted to
connect you.
mention also that the ratio of omega-6 to omega-3 in the diet is incredibly important, as you know. And there's a huge imbalance in our culture of way too much omega-6, and most of it's refined and deodorized and, you know, oxidized, really trash oils.
Yeah, it's the wrong omega-6, but we need the good stuff. We need a little bit of hemp. We need a little bit
Yeah,
of
we need GLA. We need GLA is the most anti-inflammatory omega-6. The things that will reduce inflammation are the things that will reduce cancer.
Key. Reduce inflammation. I love it. Your favorite spices then would be the curcumin that you spoke about, broccoli sprouts with the sulforaphane, any other herbs and spices? Do we like cumin? Do we like garlic? Do we like sage?
Yes, we like all the spices. The spices are the elite members of the botanical family. The spices are, you know, they are herbs on steroids, so to speak.
I like that.
You know, who's the Indian researcher at MD Anderson who's done so much work with the spices? Bharat Agarwal has published several books on the anti-cancer effects of spices. So virtually every spice is an anti-cancer compound. So you cannot go wrong with lots of spices. And I would say that natural intelligence of our body, which is driven by our taste and our smell, the spices that taste good to you are the ones that are going to help you the most.
Interesting. And that probably would include the cloves.
Sure. I mean, every spice. Clove oil is the most potent fat-soluble antioxidant known. It's 50,000 times as potent as vitamin E.
I didn't know that. My gosh, you know everything. I didn't know that. Wow. So clove oil, so there was something to when they used to put it on abscesses, there was something to that.
You bet. And there's so much that can be done with essential oils. But I think the essential survival skill is for each person to learn to tune into their own body, pay attention to what smells good, what tastes good, outside of the addictive foods of industry. But amongst real foods, the shortest good nutritional advice I know is eat real food, not too much, mostly plants. But to tune in to how you feel when you eat something, really paying attention to your body's response to food is the best way to figure out what's the best food for you. I think there are principles that apply. Whole natural foods are always better than refined processed foods. And, frying is probably not such a good way of preparing your food, and broiling is probably not such a good way of preparing food. But aside from that, everybody needs to figure out, and we need to teach our children this, to pay attention to what of the whole natural foods makes what they're drawn to by taste, by smell, and by how you feel when you eat it.
I find that's a wonderful stopping point, Dr. McKee. This has been very, very enlightening. I especially enjoy what you said about nature and forest bathing and the parasympathetic nervous system, and the fact that you were a student of William Donald Kelly just amazes me, because our careers have had a very a trajectory that's very similar. I almost
Yes.
became involved with him before I studied with Dr. Parcells, and then just did a little turn and went back to school at Columbia, became more of a clinical nutritionist. I also worked with Emmanuel Ravisi. I took some of his remedies. I never understood what he was doing. It was very difficult for me to understand, but I thought he was totally brilliant and ahead of his time. So I'm delighted that we share some of those milestones on our path. Now, the book that you have co-authored is called
After Cancer Care. After Cancer Care?
After Cancer Care. It's a Rodale Press 2015 book. You wrote it with Gerald, is it Limol?
Yeah, Jerry Lamole and Pallav Mehta. Pallav is an oncologist who's the head of integrative oncology at the MD Anderson branch in New Jersey. I forget exactly what it's called. Jerry is a retired integrative cardiovascular surgeon and the father-in-law of Mehmet Oz.
Yes, I know that. That's why I was going to just mention that. That's so cool. That is so cool.
Yeah,
so,
Jerry is a very good friend. We're actually working on a book together right now about the lymphatic system.
I love it. I love it. That's another area of great interest to me. So if people wanted to be in touch with you or follow you, how could they do that? I know that you're not actively consulting anymore.
Right. I am consulting kind of on an institutional basis, but not on a patient-specific basis. And I'm working on developing, looking at new technologies that can get really high levels of these natural products in the body, taking them by mouth. That's a very active current area of interest and research and development for me at the moment. The After Cancer Care was written for what's called secondary prevention, people that have been treated for cancer to not get it again. But you can take everything in that book except the specificity of the supplement recommendations for different cancer types. But you can look at what's in all 10 or 12 of them and take those, the ones that you find in, across the board, like omega-3 fatty acids and vitamin D and polyphenols and so forth. But the same principles apply for preventing cancer in the first place, which we call primary prevention. In fact, we've talked about rewriting the book as a primary cancer prevention book. So it would be prevent cancer care.
Prevent cancer care and prevent
cancer care
and prevent cancer reoccurrence. God forbid if you have cancer. So do you have a website we can refer to, or just?
I don't. I've never been moved to develop a website. I do. I function as the scientific director of a nutraceutical company called Life Plus, which is by far most active in Europe. So
I know it. I know it well. I know it from the 1980s very well.
Yes, the precursor. You've been to Batesville, Arkansas, and not a lot of people can say that.
Yes, they wanted me to move to Batesville, Arkansas. Yes, indeed. Those were the days, to say the least. Well, yeah. I'm very pleased that you joined us on the First Lady of Nutrition podcast. I'm delighted that this has given me an opportunity to be back in touch, and I want to thank you for doing such a wonderful forward to James Templeton, my partner's book, I Used to Have Cancer. It gives a lot of credibility.
Yes, yes. It's a very good book. I was very impressed with it.
I'm going to let him know. Okay, Dr. Dwight McKee, all the very best. I hope you'll keep in touch. That's all I can say.
Thank you, Louise.
This is so wonderful. Be well and God bless you.
Thank you. You too. Bye-bye.
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 Bye-bye.